Okay, I am sorry about that. We had someone attempt to come in the room on me, and I needed to talk with them first. So, the traditional are dopamine antagonists. They treat the positive symptoms of schizophrenia. They're less expensive because they're really old, but they do tend to have high levels of sedation and high levels of the extrapyramidal side effects, including tardive dyskinesia being one of the worst ones. We'll watch a little video on that in class, so if you want to, you can go on YouTube. It comes right off of YouTube. It's called EPS and Schizophrenia. You're welcome to watch it there too. Anticholinergic effects often come along with your traditional antipsychotics like Thorazine. Anticholinergic effects are anything that seems to deplete you of water. So blurry vision because your aqueous humor is all dry. Urinary hesitancy, constipation, dry mouth, all of those things are anticholinergic. You can also have increased chances of seizures with Thorazine and Haldol, Mellaril, and whatever the other one was that I couldn't pronounce. You would think people wouldn't want to use those. Well, they're cheap, and they work. So yes, they do use them. Antipsychotic traditional have, let's see here, Thorazine, Mellaril, Serental, and then the decanates, the long-acting Haldol and Prolixin. I hate Haldol, especially for little old people, because their creatinine clearance is horrible anyway. Most of the time, their kidneys they're functioning, but they're not like a newborn. They're not like 90+% working. They're maybe at 60% working. And if you give them something that's a decanate, which is a long-acting like Haldol, and it's sedating, they could be out for days before they're able to excrete it, metabolize it, and excrete it. But when you go to a nursing home, one of the first drugs the docs are going to pick due to cost for behaviors is going to be Haldol. So kind of get used to the idea. May not be your preference, but it does work. And that's what they can afford, so that's often what they give. Atypicals, the biggest atypical I want you to know about is Clozaril. Clozaril is nice. It's very effective. The only really bad thing about it is it can cause agranulocytosis, and that's a great big old 50-cent word that means it can mess up your differential. And if it does that, it can make you sick. So with agranulocytosis, let me give you an example. I had a patient, I don't remember what her name was, but she was in an Alzheimer's unit, and she had schizophrenia, and she was taking Zyprexa. And she had gained a lot of weight because Zyprexa, you can gain a lot of weight. It's a second generation. It's nice. It does work very well, but it can make you diabetic because you get fat and happy. Anyway, I was a new nurse practitioner, and I was trying to be a sharp one, smarty. So I said, well, let's just use this new drug. This is Clozaril. This is good stuff, and maybe we can drop a few pounds and put her diabetes back to sleep and blah, blah, blah. And so I took her off of Zyprexa and I put her on Clozaril. And, you got to take like a WBC count with a differential, an absolute neutrophil count when you start any kind of new medication like this one. And so I did that, and her weights were like 10, and her differential, the absolute neutrophils were 60% of that. And so that's pretty normal. I was like, cool, okay. So we'll check it here in about a week and see what's happening. A week goes by, and I come back in to make rounds, and I order some blood work for that day. I wanted the results called to me, and they called, and her white count was, I think it was 9. It was pretty stable, but the differential, her absolute neutrophil count was less than 1%. So agranulocytosis, biggest side effect of Clozaril, put her at high risk, especially living in a community setting of a nursing home, for, at this time of year, flu, and that would have been deadly. So if anybody gets a sore throat, cough, cold, they can really without any neutrophils to fight it off, they can die. So immediately I learned my lesson, and we came off of Clozaril. We went back on Zyprexa. She eventually did become a diabetic, and that's fine. It's better than her dying. So just know that you need to check the absolute neutrophil count with Clozaril, anybody that's on Clozaril. Other atypicals, Seroquel, Risperdal, Geodon, Zyprexa, Abilify. I like them. There's Invega, there's Risperdal, Latuda, Saffras. Saffras is kind of interesting. It's a sublingual, and you have to make sure that it completely dissolves before they can have anything to eat or drink, because if they don't have it completely dissolved sublingual before they eat or drink, you're going to get a systemic effect almost immediately, and that's not good either, so you don't want to do that. Atypical first-line antipsychotics, they are serotonin dopamine antagonists. They diminish negative as well as positive signs of schizophrenia. They have less side effects. Disadvantages, there's the weight gain and the blood glucose. And that's mainly with everything but Clozaril. Clozaril does not do that. The other ones do. Untoward side effects, we talked about the weight gain, the diabetes. The EPS is less, but it's still there. Anticholinergic, we've already talked about that. I don't think I need to revisit that. If you've had pharmacology, you should know what anticholinergic side effects are. Sometimes they can have alpha adrenergic, which is postural hypertension, tachycardia, and dizziness, basically. That is not something we desire either. So we rise slowly. They do a lot of slower movements. They have to when they're on these medications. There is the extrapyramidal side effects, which are altogether pseudoparkinsonianism, acute dystonic reaction, akathisia, and tardive dyskinesia. They're not on a continuum. Each person's different. The only one that's irreversible, in other words, it doesn't get better, is the tardive dyskinesia, which is what we got to worry about, because that is completely debilitating. Symptoms, again, there's a little video. I'm going to show it in class. You're welcome to look at it. Pseudoparkinsonianism, they look like they have Parkinson's. They have the mask-like face. They have the stooped posture, lack of arm swing when they're walking. Dystonic reaction is torticollis. The neck will really bend. They have like twisting in the back. It causes all sorts of muscle spasms. The akathisia is where they feel they have to move all the time. It's a restlessness that they feel. It's not painful, it's just restless. And then the tardive dyskinesia is kind of a combination of the twisting, and it involves the face and the facial muscles. Usually there's a lot of tongue protruding, a lot of problems like that. They do what's called an AIMS scale, and that's an abnormal involuntary movement scale to judge how bad the EPS symptoms are. If you watch the mall, I love mall watching, you can usually see people who are using antipsychotic medications, just in the way that they walk, the way that they talk, the way they blink. You're definitely going to see them on 4E. You definitely will see them on at Coleman, the way that they present themselves. If you go to the mall, though, sit down and take a look and watch the people that come by. For every 10, at least, I see 2 that I suspect are on antipsychotics. So that's my national pastime. How do we treat it? Well, we're going to treat it with the ABCs, Artane, Benadryl, or Cogentin. And sometimes you'll even see doctors being proactive. They'll have them on an antipsychotic and an ABC, just to prevent the signs and symptoms of EPS. If you look at that and you say, well, they're on Cogentin, and Cogentin is an anti-Parkinson's drug, so they must have Parkinson's. Wrong. Not in psych. If they're on that drug, it's an anti-Parkinson's drug, and chances are they're psychotic. There's an antipsychotic drug, and we're taking care of the side effects of the antipsychotic drug. Okay? let's see. I talked next about all the different ones. You're welcome to read about it. Neuroleptic malignant syndrome. Oh, Garrett, you brought this up the other day, which you can get into when tyramine foods, yes. You can also do it with high doses of antipsychotics, and we have to treat it supportively. In other words, we can't reverse it, but we can help get the blood pressure down. Some other untoward effects, diabetes, I guess we kind of addressed all these, hyperglycemia, the cholesterol with agranulocytosis, and the Zyprexa is real bad for diabetes. So, okay. Well, that's schizophrenia in a nutshell. I'm going to go in, I'm going to shut off here right now, and then I'm going to go in and talk about cognitive disorders to get us moving forward into past midterm. So hang on.